Hello, I'm Teresa Dextras. I'm an osteopathic manual therapist, and I'd like to share some information with you about the neck, and a little bit of movement and self-massage, some things you might do to help your own neck. So often people come into my office and they have pain in their neck, discomfort, tightness, or lack of mobility. And we tend to, when we have pain, separate out that part of the body like it's separate from the rest of our body. But the neck is an important point of conveyance between the torso and the head. So there's a lot of tissues and fluid and nerves in the neck. So when we look at my friend Lou here, Lou has very troublesome neck. It's not really a troublesome neck, it's a troublesome posture. Um, but anyway, Lou's neck is, well, all we can see of Lou's neck is the bones, which is, of course, one part of the neck. So the C-spine, which is 7 cervical vertebrae here in the neck. And in the cervical vertebrae, there's holes up along the side where the vertebral artery is protected and passes through. And inside that bone is part of our central nervous system, the spinal cord, where it passes from there into the brain. Maybe I'll just show you this separated out back of the head bone called the occiput that has the hole where the spinal cord passes through. And then we have little holes there where some of our venous drainage from the brain is, where the blood flow back to the heart and back to the rest of the body to get cleaned and processed after it goes to the brain. But also, of course, we have other blood flow going up and out of both ways through the brain. We have organs in the throat, in the neck, the throat. We have our air coming in, we have our food coming in, we have our drink coming in. And then we have a lot of muscles here in front. We have glands, we have the thyroid and parathyroid glands. We have the hyoid bone, which protects the front of the neck. So there's a lot going on in the neck. And then at the back of the skull, so that occipital bone, there's a place where a lot of our back muscles attach right to the back of that occipital bone. Oh, and also in the front, even coming up from here, we even have our lungs come up really high. They come up right to the top of the ribs and even into the neck a bit centrally. So yeah, there's a lot happening in the neck. So we want to remember all of those things when we're touching our necks. And first of all, before we touch our necks, I'm just going to touch my hands together and remember the quality of touch I want with my hands. The muscles and bones of the neck have a relationship with the nervous system like no other muscles and bones in the body. They're so close to the brain, for one, but it also has to do with how they develop embryologically, and the tissue they develop from is the same as the tissue that our nervous system and skin develop from. So it's a different kind of origin our muscles and bones have here. And that nervous tissue doesn't like stretching so much, so we want to be very gentle with it. So when I'm just touching my hands first, I'm remembering I'm not going to poke at my neck or squish it. I'm going to be inviting. So I want to start with that inviting quality of touch, where I'm just holding and maybe a little light traction. And for me anyway, there can be a tendency when I have a tight neck to really dig at it, but it will react to that. It might feel a bit good initially, but it will react, and we want to invite a response of increased blood flow and increased mobility and increased flexibility, rather than cause a reaction of tension. So I'm going to just kind of reach around my neck and drag my hand across. Same here. Can actually, this is one my yoga teacher Allison Irwin does a lot. Look away and then look towards as my hand drags back. So I'm looking away from my hand, and then my hand is coming this way and my head's going that way. So I'm on the top of my shoulder here, the big trapezius muscle. Part of one of the back muscle goes up in a trapezoid shape. So at the top here, it's like that, and then it goes down to our mid back. We're just going across the top of it. I can also go across my throat even if I go nice and light there. I'm just opening up. Nice light little squeeze across the top. Walk up the back. Again, I'm just kind of going walking up like that. And then I'm going along the base of the skull and just kind of coming the mastoid bone here just behind the ear. That's here on Lu. It's a little bump behind our ear. You can see that here. You can see when I do that, my sternocleidomastoid jumps out, this big muscle here. When we engage this muscle, it turns my head this way. When I engage the other one, it turns my head this way. When I engage them together, it nods my head. And so I can give those a little squeeze. Squeeze, squeeze, squeeze. Go back here to the top of those. And I can let my head soften down and then just give a little light push up with my hands. So I'm letting my head soften down, but I'm kind of going up with my hands. I'm just going along the base of the skull and just kind of lengthening my fingers out. Nice and light. And again, I can squeeze right across the back of my neck. And like a mama dog picking up her puppies, but using my hand instead of my mouth. My mouth doesn't reach back there. So squeeze down. Okay. I can come along the jaw too. Okay, just a little soft stretch of the neck so I can tip the head over in here. It's more about, rather than trying to bring the top of my head down to my shoulder, I'm reaching the ear up. And the same thing to the other side. Now I'm not trying to go for the end of range here, I'm just reaching the ear up a little bit. Play with rotation. So first I'll take my eyes, look to the right, turn my head, look to the left, turn my head. I'll let my torso follow this time. So this is how a baby moves their head. So they let their eyes become engaged and then their head turns and then their body follows. And then I might even be pushing with my leg on the opposite side. So my eyes, head, neck, torso, and down to my leg. So I'm playing with my neck as part of my body, not a separate thing that I have to just do. So now when I do a side bend, I'm not going to just do the neck, but I'm going to let my whole spine, including my cervical spine, my neck spine, come into a side bend. Same with the other way. and front back. So if you've ever been in a yoga class, you might have heard of cat and cow. So cat, just arching the back like a cat. And then cow, sway back. So I come to the side. I guess I'll turn the screen down a little bit. So here I can feel my whole spine, including my neck. Not sure if I cut off my head there. I'll check that later. Anyway, so you can go back and forth the whole spine, side to side. So the whole spine, feeling that whole curve. We can do a circle. And circle the other way. Okay. Side to side. Remember to lead with the eyes. Now a little trick sometimes. We'll just borrow Lou's head for a minute. I like to show my clients, so when they're laying down on the table and their head is in my hands and the rest of the body is attached, my hands might just be under the occiput here with my fingers right at the base there where the neck comes up to. So you can see I'm quite a long ways from the central nervous system there. There's a lot of muscle there. I think about 7 layers, and the deepest layer is called the suboccipitals, and because they're below the occiput. And they have a reflex together with our eye muscles. It's called the ocular motor reflex. It's so that we can turn our head quickly to see what we want to see. As soon as our eye muscles get engaged, those neck muscles get engaged. And you might just feel this on the base of your skull, but when someone's head is resting, I can really feel it. And I just, for example, ask them to look to the right. I can feel those muscles engaging to look to the right. And even before they've turned their head or anything, if I try to turn their head to the left, I can't often, or it would take a lot of force, which I'm not going to do. It's meant to turn to the right there. But same thing, it's not just one way. When I get them to look to the left, I can only turn their head to the left. So we can use that to turn our head further. When we're having difficulty turning our head, use your eyes. But I've also found the converse is true, that we can relax our neck by relaxing the eyes. But sometimes it's difficult to just relax them without first engaging them. So if you engage them and look one way, look the other, then just let them rest back. So I'm going to close my eyes for this. And I think it's a little bit easier if you're laying down, but you can do it if you're sitting, or I can't anyway. If I'm sitting, and I can let my eyeballs rest in the sockets. And what happens when I let the eyeballs rest in the sockets is those deep suboccipital muscles get to go off call. And so they're not ready to turn right away. They get to relax and soften. And I find I can feel this response in my fingers right away, and my clients can usually feel it as well in their neck. And interestingly enough, the other neck muscles, the other layers and further down, seem to respond as well and soften a bit. So just letting those muscles relax, like those eye muscles, like you're laying on the beach in an easy chair. And you can let the head tip a little bit and soften. Wiggle a little bit like someone's putting a little bit of olive oil and you're just sliding around on it. Or your head's bobbing on the ocean. Okay. Great. It's a little trick from some body work I used to do called Traeger. Thank you so much. Hope you've enjoyed that. And we'll talk again soon.